Well, it's no secret prescription drug abuse is an epidemic that has a chokehold on our region.
Now, but consider this. Kylie McGivern discovered 3 of the top 10 doctors in the country who prescribe Suboxone to people on Medicare practice in Johnson City. For more than a year, Kylie's dissected the impact of prescription drug abuse on our region and the role replacement drugs like Suboxone used to help wean people off those opioid addictions play in recovery.
Josh and Sarah, of the nation's more than 18,000 prescribers of Suboxone and its generic counterpart, 3 Johnson City doctors rank in the top 10. One is actually ranked second overall when it comes to Medicare claims for the drugs. The Centers for Medicare and Medicaid Services released the data this year, and a nonprofit organization ProPublica compiled the information. So why are the numbers so high? I asked the top doctors themselves. Johnson City, home to 65,000 people, breathtaking mountain views, and the highest concentration of top Suboxone prescribers for Medicare in the nation. Beneath the surface, beyond the bold numbers, is a prescription drug abuse problem as tall and wide as the Appalachian mountain range itself, deemed by many as ground zero. At a local pharmacy in Johnson City, this is the number of narcotic prescriptions written in May of 2010, and this is in May of 2015, doubled in just 5 years.
We have a tremendous problem here in the region, and it impacts all of us.
To some, like Dr. Robert Pack with East Tennessee State University's College of Public Health.
3 of the top 10?
Yeah.
Okay.
The high rate of Suboxone prescribing makes sense.
That doesn't surprise me.
After all, the most recent data available from 2013 indicates the most prescribed drug in the state for Medicare Part D is hydrocodone, a highly addictive opioid painkiller. Suboxone is a drug used within medication-assisted treatment, meant to be combined with counseling and therapy to treat opioid addiction.
There are lots of places in the country that don't have a problem at all. We just happen to be a really bad place.
Treating that high level of addiction with Suboxone,
if they really want to get clean and get clean for the right reasons, it's a great medication.
Is what brought me to Dr. Edward Crutchfield's practice.
You are the top prescriber of Suboxone in the state. Does that surprise you?
Very much so. I just have a small clinic. That surprises me.
As for Dr. Bomer Herron, the second highest prescriber in the nation and one of the first in the Tri-Cities to prescribe Suboxone.
It does not surprise me then that there are a lot of docs here that have written a lot over a 10, 12, 15-year period.
Now, the numbers that we were looking at, though, were just for 2013.
Well, and I don't know whether they look at total doses or whether they look at total number of patients, and I'm not really going to be too concerned about that.
The numbers, drawn from Medicare Part D's data and compiled by nonprofit ProPublica, take into account both patients and claims filled.
I don't think Suboxone is the treatment of first choice. It's just the one that you've got right now.
Dr. Tom Reach is president of Watauga Recovery Center in Johnson City and ranks 43rd in the state for Suboxone prescriptions. Of the top 25 prescribers in Tennessee, 19 are in our area, or in the Tri-Cities.
With the federal restriction on the number of patients that you can see, you wouldn't think that any one physician would be significantly higher than another.
That federal limit is 100 patients for every licensed prescriber of buprenorphine products, such as Suboxone or Subutex.
You'd have to ask yourself, are they in violation of the law? This is a very, very difficult limit to adhere to, considering the scope of the problem in East Tennessee and in Appalachia.
Included in that list, one of his former employees, Dr. Tracy Goen, who is also board certified in addiction medicine. Dr. Goen would not go on camera, but told us his numbers point to a severe lack of access to care and strong desire to treat those who turn to him for help. For clinical pharmacist Sarah Melton, an associate professor at ETSU's College of Pharmacy, the biggest concern in the data is the record of dangerous co-prescribing of Suboxone with benzodiazepines, like Klonopin. Here's why.
So you're going to increase the risk for respiratory depression, overdose, problems with cognitive function, and death. We're seeing that a lot in this area, and it's very concerning.
Heron, like Crutchfield and Goen, remains confident in his prescribing practices and says that given the rise of narcotic addiction and a severe lack of inpatient bed space for chemical dependency, Suboxone is the best available option.
If I'm crossways with somebody, I'm just going to say, look, if I'm not an asset to the patients in the community, just tell me. You don't have to fill out any paperwork. You don't have to do anything. I'll just go to the house. But I know what we need to ask of patients to get into recovery.
If you want to learn more about your doctor's prescribing practices, all of the information we used in this report is available online through ProPublica's research database that we have here. If you go to our website, you can find out where their prescribing practices fall, what the trends are both nationally and statewide. Josh?
Kylie, thank you. We've included a link to that database on our website tonight. Check it out at WJHL.com.